if I could have probably a dime or a nickel for every time I've heard a patient say, my mouth has to be the worst that you've ever seen, then I could retire from dentistry. But recreating smiles is just too much fun. So we don't want to retire too early. But you're not alone. And it's not, today is the first day. Life gets in the way of a lot of things. When people are afraid, they put off the inevitable. It's easy to say, oh, I don't need to go to the dentist. The tooth feels okay now. So the first thing when people come to the office and think that their mouth is the worst case that's ever been seen is that we like to let the patient know that this is a brand new day, and getting into the office is the very first step to recreating new habits and to setting forth a goal of becoming healthy in their oral cavity again. So they should be super proud of that. That's something to rejoice about. It's something to celebrate. So just coming in is a big milestone. And then that's where sedation can help get patients over the hump. Some patients are sedation patients for life. They want to be sedated for every cleaning, every filling, every crown seat that's put on. And that's perfectly fine. But my greatest joy is when patients become sedation graduates, in my opinion, where they may come in and once they realize that we are going to treat them well and kindly and like we are friends, because some people may not appreciate their family. Family gatherings can be stressful at times, but our Friendsgivings that we have where we decompress what happened at our family, that's what we want to be, is the Friendsgiving at the dental office. So I really enjoy it when patients are able to go from not being able to barely sit in the chair to having some IV sedation appointments to then graduating to having some happy gas for their cleaning appointments, and then to nothing at all. We had that happen just the other day. A patient came in and she goes, "Look at how brave I'm being, Dr. Maddox. I didn't even need nitrous today." And we took x-rays and everything. I said, "You know what? I am so proud of you." I said, "You need to get yourself a Starbucks on the way out." That's what we hope, is that patients start to feel comfortable, they start to feel loved. And that if they don't need the sedation anymore, then that is one of our greatest joys. But if they do, then we're here to provide that.